So you're an expert in bariatric surgery, and that's an area which is new for me as well. So just for my knowledge and for the audience, can you just tell us about who are candidates for the surgery?
Right. So, Shweta, when it comes to the ideal candidate for bariatric surgery, bariatric surgery is called metabolic surgery. So the name is not just for weight loss, but it is for weight loss which will help get relief from medical comorbidities. So it's called metabolic surgery. And having said that, there are guidelines which are established, and these are for the Asian population and the Indian population separately.
Okay.
And there are guidelines which are followed by IRDAI. IRDAI is the Insurance Regulatory Authority of India.
Okay.
So they have a different guideline. They are still following the Western guidelines. So first I will tell you that the medical insurance guideline is anybody above a BMI of 40 kg per meter square is a straightaway candidate for a bariatric metabolic surgery. Anybody who is less than a BMI of 40 but more than a BMI of 35 is also a candidate for bariatric metabolic surgery if it is accompanied with at least one medical comorbidity like type 2 diabetes or blood pressure, hypertension or hypothyroidism or any of these illnesses which are associated with obesity. The Indian guidelines were in line with the Asian consensus guidelines until 2 years back, and they were that anybody who is more than 37 kilogram per meter square BMI is a straightaway candidate as against 40.
Right.
And anybody less than 37, more than 32 or 32.5 is a candidate with one medical comorbidity. And anybody who is less than 32.5 and more than 28 BMI with severe uncontrolled type 2 diabetes not resolving or coming under control with intensive medical management for 1 year on the trot and referred by their physician, endocrinologist or diabetologist is also a candidate for bariatric metabolic surgery, because metabolic surgery is known to give you remission from type 2 diabetes, proven already for more than a decade, and that result for type 2 diabetes of remission lasts for at least 8 to 10 years, which means that you can be diabetes free for almost a decade if your body has been suffering from diabetes and that diabetes has not been in your body for too long. So people who are suffering from diabetes for 0 to 10 years show a much better response to bariatric surgery. Now those guidelines have even further been brought down because India is the global capital of type 2 diabetes.
Right.
So now the same guideline has come down to 27 BMI to 30 BMI for uncontrolled or resilient type 2 diabetes, and more than 30 BMI to 35 BMI for people who have one medical comorbidity, and more than 35 BMI for people who have no comorbidities. So these are all the people who can be offered a bariatric surgery.
What are the common procedures that you do in terms of bariatric surgery? If you can throw a few names.
Of course, bariatric surgery has multiple procedures. The commonest procedure performed world over and also in India by us is called the sleeve gastrectomy, where we just reduce the size of the stomach and make it into a very small, thin sleeve-like stomach, sleeve as in the sleeve of a shirt, but it essentially looks like a banana. So a bag-like stomach becomes a banana-shaped stomach, and it's actually a volume of 80 to 100 ml. So that's a drastic reduction in volume from a 1.5 to 2 liter stomach to a 80 to 100 ml stomach. So that's a restrictive surgery. So that's your first classification. Then there are malabsorptive surgeries and restrictive plus malabsorptive surgeries. So essentially all the other procedures have an element of restriction in it. So the traditional gastric bypass or the Roux-en-Y gastric bypass is one of the oldest bariatric procedures, and it has stood the test of time over the years, where we create a stomach pouch which is only 40 ml. Like the size of an egg, and then you can connect it with a loop of a small intestine, and then you connect that loop to the original loop of the small intestine. So the food goes from one passage, the digestive juices go from the other passage. So it actually looks like this, so that's why it's a Y.
Right.
So that's why it's called Roux en Y. Roux is after the surgeon who invented the procedure. He was a French surgeon called César Roux. That is also very good for diabetes remission. But there are procedures which have now come over the last decade and a half, which are even more powerful anti-diabetic procedures,
Okay.
like the one anastomosis gastric bypass and the sleeve plus procedures. And in the Indian population, especially in my practice, I do a lot of sleeve plus procedures. Those are the sleeve gastrectomy with a duodenojejunal bypass and sleeve gastrectomy with a single anastomosis sleeve jejunostomy. So these are very complex names, but essentially what we are doing is doing a sleeve gastrectomy and then bringing a loop of the intestine and joining it to that sleeve. So that gives you very good weight loss and gives you good remission from type 2 diabetes. And the effect of remission of diabetes starts immediately post-operatively, even before the weight loss effect of the surgery kicks in.
Okay.
So we send our patients home, diabetic patients home, patients who have been on insulin until the day before the surgery, patients who have been on 1 or 2 or 3 drugs for diabetes. Without any of these medications, we send them home because the anti-diabetic effect kicks in immediately.
Amazing.
There are also some non-surgical bariatric procedures which have created a lot of buzz nowadays. One is the intragastric balloon. Yeah, and the other one is endoscopic sleeve gastroplasty, where you can stitch a part of the stomach, at least the lower half of the stomach, like a sleeve that we do from externally by laparoscopy or robotics. But they are not as great a procedure as the conventional bariatric metabolic surgical procedures. You will not get that great an effect of weight loss or remission of diabetes from these two lesser invasive procedures in your body, but they definitely have their place in the market of weight loss as far as procedures are concerned.
Okay, so the next question is about prehab. We've identified people who need to consider the surgery, but as we know that no procedure could, guarantee you or be like an ironclad guarantee against becoming obese again or being diabetic again, and that lifestyle changes have to accompany any procedure, whether it's your cardiac or a gut-related surgery. So typically, when somebody comes in and inquires, for a procedure, do you tell them to also kind of undergo a few lifestyle changes before the surgery?
Yeah, I think that is a very, very important question that you've asked, Shweta. What happens is that, like I already mentioned, there are different BMI. People come with different BMIs, which means that they're at different weights with different heights, and there's no set formula for every patient. But in my practice, what I try to do is that from the first time that the patient steps into my clinic till the time that the patient goes to the OR table, we meet at least 2 or 3 times, sometimes even more. A person suffering from class 1 or class 2 obesity needs to do a few things, like if they are into smoking or consuming alcohol, they need to stop that, and we stress the importance of doing that. And unless you're committed to your own cause, you are not going to do that, then you're not a great candidate for the surgery, right? Next comes people who are like more than 40 BMI. I like to put them on a VLCD. When I put them on a VLCD, I know their commitment towards their weight loss goal. And in that case, it won't even be a bad idea to refer them to somebody like you who would actually prepare a plan for nutrition, also look into their lifestyle. They would be able to maintain a diet diary and an exercise diary that will really show their commitment towards the goal, and it will also help me prep the body physically.
Yes.
And bring it as close to normal so that the body can tolerate general anesthesia for on an average 4 hours,
which is less risky.
Yes, and make the body really risk free for the procedure, and the patient can go home as planned in 24 to 36 hours, which is what we normally want our patients to recover in that much time and then go home. So that's the prehab, and there are various types of prehabs, is extremely important for every bariatric surgery.
So for me, prehab is, of prime importance from multiple angles. Number one is, as you rightly said, their commitment to maintain results after the surgery is over. Now, whether you go for a weight loss surgery or you go for liposuction or any other surgery for that matter, where your weight will be reduced, if you don't know how to maintain your results, because we do know that obesity is just not a physical thing, it's also a mental thing. So if you can put yourself under a rigorous plan for about at least 3 months before the surgery, you'd be able to understand what to do after. And we do know that these are restrictive surgeries so that we can also arrest the muscle loss that accompanies these surgeries post. So we can put them on a good exercise program for them to at least build a little muscle mass before they go in for these kind of surgeries. And at the physical level, their habits and their relationship with food, maybe a psychological intervention. So multiple things, put together would help them have better outcomes from these surgeries and not bounce back to where they were.
I completely agree with you, and especially the point that you made about the muscle loss after the surgery. If they are not in line with a proper plan, then patients not only lose fat, they also lose muscle, and they get a haggard look. And that is something that patients always ask me before surgery, that I know somebody who did this surgery and now their whole skin is hanging from here and hanging from there and doesn't look good. And this is exactly what I tell them, that unless you enroll yourself into a fitness program, you're not going to be able to avoid that.
Right. So typically what happens after surgery, the main part?
So like I said, if the person is diabetic, the anti-diabetic effect kicks in immediately. A person suffering from sleep apnea, people using a CPAP machine daily and who cannot sleep without it, actually get rid of it in 3 weeks, which means that our brain is so smart that it takes away the most dangerous fat first. So the fat around your airway is cleared first, which means that the person who snores like a truck engine without a CPAP stops using a CPAP machine and is not even snoring in 3 weeks time.
This is mechanical.
It's mechanical obstruction, but the brain has taken care of that. It is so the brain, the basic mechanism of bariatric surgery is that the brain starts mobilizing all the fat that you had saved for a rainy day. Bariatric surgery is that rainy day, which has been created artificially by the surgeon, and hence the weight loss which the brain starts and triggers after that is the most natural form of weight loss. It's like I have put you on an island and you have only one coconut tree which is dropping 2 coconuts one morning, one evening, and that's all you're getting
to survive.
That's all you get to survive. You're going to lose weight. You've seen one of those movies where Tom Hanks is cast away or something.
Cast away.
Yeah. So that's exactly what bariatric surgery does, and the hormonal changes it brings about because of the bypass takes care of the diabetes, takes care of the blood pressure, takes care of the lipid levels. So you start shrinking overall. And like we already mentioned, even the muscle loss, if you start exercising, then all the protein that you're consuming will hold on for the muscle to be retained and also to be built further, because there's skin, then there is fat, and then there is muscle. So if the fat is shrinking, you want the muscle to grow and fill up that space so that the skin goes and hugs the muscle. And that's very crucial. So that's going to happen in the next 8 to 10 months. And then suddenly one fine day the brain realizes that, okay, now this guy is eating a decent amount of food which is protein rich, because now you've understood that this is your commitment for life. I want to live a healthy lifestyle. I want to look as good as I am looking right now. I have given up my old wardrobe. This is a new wardrobe that I want to fit into, and I'm feeling good. I'm feeling energetic. I can work like I used to work once upon a time when I was not obese. And when all these things happen, then the brain says, okay, good, now I need to stop. I've consumed enough, and you plateau. And that's probably where your surgical mechanism stops working and you go on a maintenance phase. Now if you revert back to your old habits and deviate from the path, statistically 15 to 20% of the patients are going to regain weight after a bariatric surgery in 1 to 5 years after the surgery. These are those 15 to 20% of people who will regain weight because they have deviated back to their old habits.
What about the follow-up rate? Like, do patients keep up with you after surgery?
Unfortunately, despite the level of education of patients, despite the level of awareness, we still have 50% of dropouts at the end of 1 year. And I'm not saying that people who drop out don't maintain their weight. There are people who have understood the whole mechanism very well and are still maintaining weight. One of my patients recently came to me after some 15 years of his weight loss surgery and is still looking so good.
Wow.
Maintaining his muscle mass. He's got a good bulk of muscle because he's been in weight training for the longest time.
Lovely.
And then on the other hand, there are patients who have put on weight in just 2 or 3 years post bariatric surgery because they lost their weight. Then they thought, okay, now things are cool. I think I can cheat a little. And once you get into that mode of cheating with food, cheating with alcohol, then the whole thing goes for a toss again.
We can't forget that the stomach is a muscular organ and it can go back to its original size to some extent. This is the reason why I stress on prehab, because this is where the training happens of what you're going to take, after surgery. If you want to maintain results, you can't look at these surgeries as a quick, fix for your weight problem. You have to take it as a starting point, and then there's so much work to be done after. And I don't think that people understand the commitment and the amount of effort they need to put in. Very simple thing, when people come to me for their weight loss journey and they're on the diet and exercise program, and somewhere in between they would say, अब हम वो पुराना diet कब ले सकते हैं? And the answer is कभी नहीं. Because if you've taken a route to go from point A to point B, and now you change your route to go from point A to point C, you're not going to reach B. You're going to be at C. So you decide where you want to go, and when you begin this journey, you need to know the amount of commitment and effort that's going to be required from your end to maintain the results. You and I are just the starting points. And we are facilitators and we are the coaches and we're teaching them things and strategies, but finally, if they really want to maintain the results, like you said, there are few people who do it. I've had a case where, this boy who lost 75 kgs without any surgery.
Wow.
Over a period of 2 years, and he still maintains it.
Super.
And it's amazing. And I always give as example to people that, you can achieve it, and you have to also give him credit for the amount of work he does after having achieved that result. He's not taking it easy anymore. And he's made that his permanent lifestyle change. So like you rightly said, again, the follow-up is so important because you need to be in touch with your doctor and your dietitian to make sure that you're maintaining your muscle and your results, and that whatever you did as a starting point is now taking you for the long term.
So one important thing I would just like to add here, Shweta, is that what you mentioned about the level of commitment that is required. The way I make them understand the level of commitment is I connect a new patient to at least 3 or 4 operated old patients who range from being operated as recent as 1 year back to as old as 15-20 years back.
Okay.
And that's when they understand what kind of commitment is required, and then they realize that, oh, am I really ready for this? And that's where you will also have very few dropouts, but majority of them actually get convinced that yes, I want to be that. And that is what clicks in favor of bariatric metabolic surgery, because now I have a big database of patients from different parts of the country, city, and different parts of the world, and all these patients who come to me, the new ones, can connect with any one of them and say that, okay, fine, this is what amounts to having a bariatric surgery, and this is what one needs to do or not do.
It's so wonderful, actually. Your patients are so cooperative and they are willing to help others. This is what I tell my clients as well, that please give us your feedback and share your experience through videos, because this is going to encourage and motivate someone else on their journey. And this is not about boosting our practice, but this is about sharing experiences, because 2 people will relate to each other more than me counseling and telling them 100 things, which of course I would motivate on a different level, but when they see somebody else go through the same journey and achieve that result and what it took out of them to maintain it, it's different and it's beautiful.
I think so. I think the journey is very important. If you see somebody else's journey, you want to walk that same path.
Exactly, right. And you know it's doable.
Absolutely.
Great. Thank you so much for sharing all this valuable information from your experience. I've learned so much today, and I hope you had a good time.
I had a lovely time. It was my pleasure to be here with you, Shweta, on this show today. And of course, learning is always two ways, and it's never only one person learning. So I'm happy that I had this interaction with you with regards to diet and lifestyle and nutrition and how you are so meticulous in planning things. It's been absolutely a pleasure. Thank you so much.
Thank you.